So this is probably one of the more important recordings that I'm going to give you as far as mini lectures, and it's regarding communication. So communication is a skill, and it is teachable, and it is something that people can improve on. So it's something that a characteristic, and I don't even know characteristic is the right word, but communication is a skill that is very different than a characteristic or an appearance such as blue eyes, brown hair, height, that is fairly static. I mean, if you're 5'10" at age 30, you're likely not going to grow to be 6'1". You may shrink a little bit as you get older. If you have blue eyes by age 5 or 6, you're likely to have blue eyes through your lifetime unless you change contact colors. So my point is, communication is one of those qualities that is changeable and that people can improve on. Just share a brief example. I had a patient, this is my second year of practice, that I wasn't too happy regarding this situation. Let me give you a little bit of context. She arrived for her appointment about 20 minutes late, and at that time we only had 30-minute visits. And so I remember this very well. She actually arrived 22 minutes late. Fairly frazzled and just fairly scattered. And I shared with her, the first thing I said was, I only have 8 minutes with you. What would you like me to do for you today? And she was upset and was up crying, and I wasn't quite sure what was going on. She talked about, and this was in northeast Portland, Portland being a city, metro area of about 2 million people. So her bus was late. And so, being a little bit arrogant on my part, and I would say it was a little bit arrogant, so I'm like, well, you could have got an earlier bus. That's starting out pretty rocky in terms of relationship, especially for the person I'd never met before. As a PT evaluated this individual person, and I was the second person to see her. So, I did grant the person what they wanted. I did bill for one unit because it was 8 minutes, and mainly around education to help the person manage back pain, reviewed a few exercises, and then placed them on hot packs, which is what she wanted. So I essentially blew it, really. The person did complain to the PT, who they saw the next time, about what had happened, and shared a lot more personal information about why she was late, which she was more comfortable doing with a woman. But I never gave her the time to share about her situation, except that she was late getting on her bus. The person also was homeless, was struggling to get a roof over the head. I did not know that. The individual was also making the decision to come here with her limited resources to visit us in PT versus, taking care of some other needs, such as trying to find a place to stay. So my point is, communication is really where it's at. It's really hard to get someone to buy into therapy if you do not establish rapport with them right away. In talking with Beth Thorpe, who's the Director of Clinical Education here at Lane, and multiple other Director of Clinical Education, or DCEs, these are the individuals that place students in clinic. The number one issue that comes up in clinic is not about skills of the PTA regarding being able to use an ultrasound head or teach an exercise or stretch a muscle. It is basic communication between the PTA and it's the PT also. It's not just a PTA-PT thing. I've heard this consistent message from clinical instructors who have supervised PT students, that it's communication. And it's also communication between clinical instructors and the clinician, meaning the SPTA. So, this is why this chapter is important. It's a skill that you will learn and get better at. I do want to give you just a brief few minutes to help walk you through the chapter because I think it can be a little overwhelming. It's actually a very interesting chapter, so I hope you embrace it. I would learn what the LAMP document is, not that I'm going to give you a long worded question on this regarding an exam. So I'm looking at the e-version right now, which is an e-book, right? So it's not your paper book, but it's the exact same content. LAMP is just a leadership development. You can see the acronym LAMP and what it spells out to be of how to develop some better skills as professionals. And it's something that's open to you as APTA members. And then that's all I want you to know about LAMP. And then the difference between verbal and nonverbal. This keeps increasing nonverbal communication. It used to be about 80%. Now it's seen as 90% of communication. So it's not what you say, it's how your body language is. Whether you're open to somebody or you're closed. Meaning sometimes when patients come in, we rush them along and just kind of use our hand gestures to sometimes even not intentionally, but just kind of signify we got to hurry. And that is can be faulty on many levels when you're working with somebody with a health condition where moving quickly is actually painful, or they're maybe not getting what you're saying or teaching, and you're just using body language to kind of push them along because you have a checklist to go through. So, and then it gets into what is professional behaviors in communication. 7-2, I think that's an excellent section. And levels of professional behaviors for students and professionals in communication. I can't say that many of our graduates are definitely entry level in this capacity. And I would say some of our graduates, even by the end of their first year and into the second year, are entry level, even before they go out and touch a patient. But however, most, and this is, don't take this personally, it's kind of where I was at, and everyone's right. We're not expecting you to be entry level on the first term in your PTA program because, first of all, it's a whole new way of life for you. You're not an aide. Even though some of you have had a lot of professional experiences in your life, it's not expected of you to be entry level in communication as a PTA next week or this week. That's not realistic. Then post-entry level, this is with multiple years of experiences. This would be hopefully where you'll be out in, 10 years, 15 years, 20 years. And I would say that those that I know that are really good at what they do are definitely post-entry level. And as communication is where they're at. They may have great skills too, which makes them even more awesome therapists. But having great skills and not having this can affect your ability to get patients better. And then it goes through the nonverbal and verbal communication skills. These are things I want you to really be memorizing too. The nonverbal components of all of this, and know what these words are: oculesics, haptics, posture, proxemics, and gesture. So all of these. And then we could talk for hours about communication, but we're just going to give you an introduction here. This effective multicultural healthcare environment, we're consistently seeing more diversity in our workplace, and this is where we want to be as culturally proficient. I would say that with my interaction with my one patient, I certainly wasn't in cultural destructiveness. I think I was more in cultural incapacity, to be quite honest, and then cultural blindness. So I was on the bottom level. I was probably more around here. So cultural proficiency really comes postgraduate, but some people make it about here by graduation, but most people don't. Most people think they're here, but they're not. It takes a lot of skill and practice. Different cultures, high context, low context, is what I want you to know. So enjoy this chapter, and I look forward to talking to you more about it.